Good afternoon and welcome. Today, we delve into a deeply divisive and ethically charged question. Should animal testing for scientific research be made illegal? This topic touches upon fundamental questions about animal welfare, scientific progress, and human health. Joining us to debate this complex issue are two distinguished experts. Dr. Evelyn Reed, an ethicist and prominent animal rights advocate who argues in favor of a ban, and Dr. Kenji Tanaka, a medical researcher who contends that such research remains necessary under strict regulation. Our debate will proceed with opening statements, followed by rebuttals, a moderated discussion, and concluding remarks from each speaker. Dr. Reed, would you please begin with your opening statement?
Thank you, Alex. The core of my argument is straightforward. Subjecting animals to potentially harmful scientific experiments is fundamentally unethical and increasingly scientifically outdated. We must acknowledge that animals are sentient beings, capable of experiencing pain, fear, and distress, much like us. Therefore, they possess an inherent value and a right to be treated with respect, not merely as tools for human ends. There is a profound moral inconsistency in performing procedures on animals that we would find abhorrent if performed on humans, regardless of the potential benefits. Beyond the ethical imperative, the scientific justification for animal testing is facing serious challenges. Significant physiological differences between species mean that animal models often fail to accurately predict human responses to drugs and diseases. History is unfortunately littered with examples of treatments that proved safe in animals but were harmful or ineffective in humans, and vice versa. Fortunately, we are no longer reliant on these crude methods. Remarkable advancements in alternative methodologies, such as sophisticated in vitro testing using human cells and tissues, organ-on-a-chip technology that mimics human organ function, and powerful computer modeling, offer more relevant and often faster results. These human biology-based approaches avoid the pitfalls of interspecies extrapolation and hold the key to more effective and ethical research. It is time for a paradigm shift. We must redirect funding and research efforts towards validating and implementing these humane alternatives. Continuing down the path of animal testing is not only an ethical failing but also hinders truly progressive human-relevant science.
Thank you, Dr. Reed. Dr. Tanaka, we now turn to you for your opening statement.
Thank you, Alex and Dr. Reed. While I deeply respect the ethical considerations Dr. Reed has raised, and indeed share the goal of minimizing animal use, I must argue that a complete ban on animal testing at this time would be premature and detrimental to human and animal health. Animal research remains an essential component of the biomedical research process, particularly for understanding complex biological systems and ensuring the safety of new medical interventions before they reach humans. Let us not forget the monumental medical advancements facilitated by animal research. Vaccines for polio and measles, the discovery of insulin, antibiotics, blood transfusions, cancer therapies, and complex surgical techniques were all developed or refined through studies involving animals. These breakthroughs have saved countless lives and dramatically improved quality of life worldwide. The reality is that the sheer biological complexity involving intricate interactions between organs, the immune system, and metabolic processes cannot yet be fully replicated by current non-animal models, despite their advancements. Studying diseases like cancer, Alzheimer's, or infectious diseases, and testing the systemic effects of potential drugs often requires a whole living organism. Furthermore, animal research is not conducted in a vacuum. It is governed by stringent regulations and ethical oversight committees worldwide. The widely adopted 3 rupees principle, replacement, using alternatives whenever possible, reduction, using the minimum number of animals necessary, and refinement, minimizing pain and distress, guides all ethical research. Researchers have an ethical obligation not only to animals, but also to human patients waiting for cures. Using animal models, when deemed absolutely necessary by rigorous ethical review, is part of ensuring the safety and efficacy of treatments before human trials commence. It's also important to remember that this research often benefits animal health as well, leading to new veterinary treatments and medicines. Therefore, while we must vigorously pursue alternatives, animal research remains, for now, an irreplaceable tool in specific contexts within the broader landscape of biomedical science.
Thank you, Dr. Tanaka. We will now move to the rebuttal phase. Dr. Tanaka, you have the first opportunity to respond to Dr. Reed's opening statement.
Thank you. Dr. Reed raises valid ethical points concerning animal sentience and suffering, which the research community takes very seriously. However, we must carefully balance these important concerns against the potential harm to human populations if vital research is abruptly halted or significantly delayed due to a complete ban. Imagine facing a novel pandemic without the ability to rapidly test vaccine safety and efficacy in a living system before human trials. Regarding the alternatives, while technologies like organ-on-a-chip and computer modeling are promising and valuable adjuncts, the reality is that current alternatives cannot fully replicate the complex interactions within a whole organism. They struggle to model systemic effects, long-term toxicity, or complex diseases involving multiple organ systems, such as autoimmune disorders or neurodegenerative diseases. Dr. Reed mentioned the predictive validity issues. While no model is perfect, including animal models, they provide crucial data within a complex biological context that helps identify potential safety issues before human exposure. To dismiss the entire approach based on some failures ignores the vast number of instances where animal studies have been essential for ensuring drug safety and efficacy, preventing human tragedies. The rigorous ethical protocols and the 3 rupees framework are not mere lip service. They represent a genuine commitment to minimizing harm and actively seeking alternatives. A complete ban dismisses this ongoing effort and the necessity that still exists.
Thank you, Dr. Tanaka. Dr. Reed, your rebuttal?
Thank you, Alex. Dr. Tanaka emphasizes necessity and regulation, but I must challenge the premise that the current system is acceptable or truly indispensable. The reliance on necessity is often challenged by the significant number of drugs that pass animal tests only to fail in human trials. Some estimates suggest over 90% for certain classes of drugs. This high failure rate not only questions the scientific validity, but also means that vast numbers of animals suffer in experiments that ultimately yield no human benefit and potentially delay the development of effective treatments based on more relevant models. Furthermore, there have been tragic cases where animal tests failed to predict serious side effects in humans, such as the thalidomide disaster, reminding us that animal models can provide false reassurance. While regulations like the 3 rupees are well-intentioned, they operate within a system that fundamentally accepts the use of animals as research subjects. Refinement can lessen suffering, but it cannot eliminate the inherent ethical conflict of deliberately harming sentient beings for the potential benefit of another species. Reduction still involves using animals, and replacement is often hampered by institutional inertia, insufficient funding for alternatives, and lengthy validation processes. We need to question why the adoption of demonstrably effective alternatives isn't happening faster. Is it truly scientific limitation or a reluctance to abandon established practices? The argument about past successes doesn't justify future use when better methods are emerging. Science evolves, and our ethics should evolve with it. The fundamental ethical conflict remains. Can we justify inflicting suffering based on species membership? I believe we cannot, especially when science itself is pointing towards more human-relevant approaches.
Thank you, Dr. Reed. We now enter the moderated discussion phase. I have a few questions for both of you. Dr. Tanaka, you mentioned the 3 rupees and the commitment to minimizing harm. Given the acknowledged limitations and ethical issues, what specific, concrete steps beyond the current 3 rupees framework is the research community actively taking to phase out animal testing where possible, perhaps setting more ambitious timelines?
That's a crucial question. Beyond strictly adhering to the 3 rupees, There's significant investment in developing and validating new alternative methods, NAMs. This includes international collaborations to standardize protocols for things like organoids and computational toxicology, making regulatory acceptance easier. Many research institutions now have dedicated centers focused solely on developing alternatives, and funding agencies are increasingly prioritizing grant applications that incorporate or develop NAMs. There's also a push towards more data sharing, pooling results from both animal studies and NAMs to refine predictive models and reduce redundant testing. However, setting fixed timelines for a complete phase-out is scientifically challenging because progress depends on breakthroughs that are hard to schedule. The focus is on accelerating replacement wherever scientifically sound.
Dr. Reed, if a complete ban on animal testing were implemented tomorrow, as you advocate, how would society realistically address the immediate challenges in developing and testing treatments for new complex diseases or unexpected health crises, especially where validated alternatives might not yet exist?
That's a scenario that requires a significant and immediate shift in resources and scientific strategy. Firstly, a ban would necessitate a massive, urgent investment in the validation and scaling up of existing alternatives. The focus would shift entirely to human-based methodologies. For complex diseases, this means intensifying research using human genetics, epidemiology, advanced imaging, microdosing studies in humans, and sophisticated computational models fed with human data. In a public health crisis, resources would be channeled into rapid development of human cell-based assays and potentially carefully monitored human trials initiated earlier, perhaps using adaptive trial designs, based on extensive in vitro and in silico safety data. It would certainly be challenging initially, requiring a different risk-benefit analysis focused solely on human data, but arguably, focusing all our ingenuity and resources directly on human biology, rather than relying on imperfect animal proxies, could ultimately accelerate the delivery of truly effective and safe treatments.
A question for both of you now. Is there potential for a stronger middle ground? For instance, could we see significantly increased mandatory funding for alternatives, coupled with much stricter, legally enforced limitations on animal use? Perhaps banning testing for certain product types like cosmetics, already done in some regions, or restricting it only to life-threatening conditions, stopping short of a full, immediate ban? Dr. Tanaka, your thoughts on such a middle ground?
That approach describes much of the direction regulatory bodies and ethical researchers are already pursuing, albeit perhaps needing acceleration. Increased funding for alternatives is always welcome and critically needed. Stricter limitations are also constantly evolving. Cosmetic testing bans are a good example. Defining limitations based on the severity of the condition, e.g., only for life-threatening diseases, is complex, as research into less severe but widespread conditions is also vital for public health. The challenge lies in defining those limits without inadvertently hindering necessary research for conditions that might not seem immediately life-threatening but cause significant suffering or disability. A carefully regulated, continuously reviewed approach focusing on the 3 rupees, enhanced by robust funding for NAMs, seems the most responsible path forward currently.
Dr. Reed, would such a middle ground be acceptable, even as an interim step?
Any step that genuinely reduces and replaces animal use is positive, and increased funding for alternatives is essential. However, a middle ground that still permits significant suffering for sentient beings remains ethically problematic from my perspective. While bans on cosmetic testing are welcome, they represent the lowest hanging fruit. The vast majority of animal testing occurs in biomedical research. Stricter limitations are necessary, but they must be ambitious and have clear targets for phase-outs, not just indefinite continuation of the status quo with minor adjustments. My concern with the protracted middle ground is that it lacks the urgency needed to drive the fundamental shift towards human-relevant, animal-free science. It risks becoming a justification for continued, albeit slightly reduced, harm.
One final question for this section, directed to both. How significant are the species differences, biologically speaking, and what specific methodologies does research employ to account for these differences when attempting to translate findings from animals to humans? Dr. Reed, perhaps you could start?
The species differences can be profound, extending from genetics and metabolism to immune responses and organ physiology. For example, rodents, commonly used in research, have different metabolic rates, lack a gallbladder unlike humans, and have different drug absorption pathways. These differences are precisely why translation is so challenging and often fails. Attempts to account for them involve using multiple species, genetically modified animals, humanized mice, and complex scaling calculations, but these are often imperfect workarounds. Ultimately, trying to bridge these gaps highlights the inherent limitations of using one species as a predictive model for another. Focusing directly on human biology with NAMs bypasses this fundamental problem.
Dr. Tanaka?
Dr. Reed is correct that species differences exist and present challenges. No responsible scientist denies this. However, there are also significant conserved biological pathways and similarities, particularly in mammals, that provide valuable insights. Researchers carefully select animal models based on the specific biological system being studied, choosing species that share relevant characteristics with humans for that particular aspect. Methodologies to improve translation include using species phylogenetically closer to humans, like non-human primates, though their use is highly restricted and debated. Employing sophisticated genetic engineering to introduce human genes or cells into animals, and integrating animal data with in vitro human cell data and computational modeling. It's not about blindly applying results, but about using animal models as one tool among many to understand complex biological principles and identify potential safety signals before human trials. It provides a layer of understanding, albeit imperfect, that NAMs alone cannot yet fully offer for systemic effects.
Thank you both for that insightful discussion. We now move to closing statements. Each of you will have a final opportunity to summarize your position. Dr. Tanaka, please proceed with your closing statement.
Thank you. In summary, while the ethical concerns surrounding animal research are valid and demand our constant attention, a complete and immediate ban would be, in my view, irresponsible and detrimental to public health. Animal research has been instrumental in nearly every major medical breakthrough, alleviating suffering and extending lifespans for both humans and animals. While alternatives are advancing and are embraced wherever possible, they cannot yet fully replace the need for studying complex biological interactions in a living organism, especially for ensuring the safety and efficacy of new medicines and vaccines before human exposure. The research community is strongly committed to the principles of the 3 rupees: replacement, reduction, and refinement, operating under rigorous ethical oversight, and actively investing in the development of non-animal methods. To dismantle this carefully regulated system prematurely, before alternatives are fully capable of shouldering the entire burden of safety and efficacy testing, risks stalling medical progress and potentially compromising patient safety. Responsible animal research, conducted ethically and only when necessary, remains a vital component in safeguarding and advancing human and animal health for the foreseeable future, even as we strive earnestly towards an eventual transition to fully alternative methods. Thank you.
Thank you, Dr. Tanaka. Dr. Reed, your closing statement, please.
Thank you, Alex. To conclude, the case for ending animal testing rests on 2 pillars: unwavering ethical principles and burgeoning scientific evidence. We have a moral obligation to recognize the sentience of animals and to end practices that inflict deliberate harm and suffering, regardless of perceived benefits. Continuing to exploit animals as mere tools for research is incompatible with our evolving understanding of ethics and compassion. Scientifically, the limitations and potential dangers of relying on often poorly predictive animal models are increasingly clear. The high failure rate of drugs translated from animals to humans and the existence of misleading results underscore the need for a shift. Excitingly, science itself offers the solution. Advanced human-relevant methods, from organ chips to AI-driven analysis of human data, promise not only to replace animal testing, but to provide scientifically superior insights into human health and disease. These innovative approaches deserve our full support through robust funding and policy changes that accelerate their validation and implementation. It is time to align our scientific practices with our ethical values. We must invest in humane innovation and make a decisive move away from animal testing. A truly progressive and ethical society must extend its circle of compassion to include the sentient beings we share this planet with, and embrace the modern science that makes this possible. Thank you.
Thank you, Dr. Reed. And thank you, Dr. Tanaka, for sharing your expertise and perspectives in this rigorous and thoughtful debate. You have clearly articulated the profound tension at the heart of this issue. The ethical imperative to prevent animal suffering weighed against the complex demands of scientific discovery and human health protection. As we have heard, there are compelling arguments on both sides, highlighting the significant scientific, ethical, and societal dimensions involved. There are clearly no easy answers, and the path forward requires careful consideration of evolving science and societal values. We hope this discussion has provided our audience with valuable insights to reflect upon. Thank you.